My typical patient is usually somebody who's had a knee or shoulder injury. So they come into the office. They either are dealing with more of a chronic pain or, as I said, an acute injury, and they may be an athlete who's wanting to get back to sports, or weekend warrior who just wants, or a dad who wants to play with their kids. But there's somebody who, because of what they're dealing with, is unable to do their normal activities.
As a shoulder specialist, one of the most common problems that I see is frozen shoulder, or what is termed adhesive capsulitis. And adhesive capsulitis is inflammation of the lining of the joint that surrounds the bones of your shoulder. And the hallmark of frozen shoulder is extreme pain and also stiffness. Shoulder arthritis is another common problem that I treat. It's more uncommon than the hip and the knee, and so many people don't know that there are treatment options for shoulder arthritis. As always, we start with conservative care, but when people have persistent pain despite non-operative care, there are treatment and surgical options available to patients.
In order to develop a proper diagnosis, we really want to take into account the major factors being the history of what happened, the physical examination, any pertinent diagnostic studies, and really we use that kind of as a basis to formulate either a working diagnosis or a definitive diagnosis.
When patients do well, especially patients who have other issues in their life, and we can make a small positive difference in their lives, it's everything in the world. It's what we do, it's what we train, it's what we study for. And that's how we make impacts in people's lives. And it's not just a job or career, it's helping people, and that's the most important thing.